The kidneys and the heart are really connected very deeply when it comes to risk and disease progression. First and foremost, we know the high blood pressure is a tremendous risk factor for both of them, a progressive disease in both heart and kidney disease. And it's imperative that you have good control, especially when you've been diagnosed with a problem with either of them. We also know that there's a feedback loop that occurs between the heart and the kidneys. And what that means is that a change in one of them always impacts the other. So a weakening of the heart can worsen kidney dysfunction. Kidney dysfunction can worsen and increase the risk of heart attacks. Risk factors for development of both heart disease as well as kidney disease include high blood pressure, diabetes, high cholesterol, smoking, obesity, as well as general risk factors we think about such as diet. Most of these are modifiable. So by modifying your risk factors such as high blood pressure and cholesterol, as well as your diabetes, you can have a beneficial effect on both the progression of kidney as well as heart disease. The worsening of your kidney function will increase your risk progressively of heart dysfunction. And that can be due to several factors. One factor is the blood pressure, which can be more difficult to control as the kidney function worsens. The second is anemia. So the kidneys are very involved in the production of blood cells. And if you don't have enough red blood cells, it makes it harder to supply nutrients to the rest of the body, making the heart work harder and eventually having problems. The third is that the electrolytes, the chemicals in the blood, are filtered through the kidneys. And if you're not able to appropriately handle them because of kidney disease, you can have problems with your heart function as well. Both for kidney disease and heart disease, they're progressive disease processes. So if you're able to catch them early, there are many things that we can do to modify the risk and avoid the progression. And it takes a very close relationship between the patient and the doctor to do that, often with frequent checks and honest communication.